Welcome everyone to the 11th webinar in our 23-24 virtual meeting series. Tonight this is our fifth webinar on primary financial assistance programs for Fabry disease. So with me, my co-host is Casey McKenna, our Senior Program Manager for Education and Community Support. And our speaker tonight is Jill from NORD. And Casey's going to introduce Jill in a little bit more detail. And then what we usually do is we do the brief introductions. We have the talk tonight by Jill, and then we'll have a question and answer period, and then we'll do the prize drawing. So Casey, your turn.
Great. Thanks, Jerry. And just to add to what Jerry said, if you do come up with any questions while we're talking, feel free to add them to the chat and I'll ask them to the group later. Okay. And then without further ado, I would like to introduce Jill Polander. She is the Vice President of Patient Services at NORD, the National Organization for Rare Disorders. She is a registered nurse with over 30 years of diverse healthcare experience, from the emergency department to long-term care to pain management and palliative care. As a member of NORD's leadership team, she oversees their patient services department, including the patient assistance programs, information and resource services, and clinical trial support. Please welcome Jill.
Thank you, Casey.
Welcome, Jill.
Thank you, Jerry. I'm going to just take a moment here and share my screen. That working for everybody? All able to see?
Yes.
Terrific. This way you don't have to just stare at me for the next little bit. Well, again, thank you all for inviting me to chat with you this evening. I'm delighted to represent the National Organization for Rare Disorders and talk with you a little bit tonight about the patient assistance program that we provide for Fabry disease patients. NORD has a tagline that goes, "Alone we are rare, together we are strong." And I think as members of the rare disease community, we recognize just how important that is. A little bit about NORD. NORD is celebrating our 40th anniversary this year. We have been representing the rare disease community since our founding 40 years ago by a group of families, a group of rare families who bonded together and really created the impetus for the passing of the Orphan Drug Act. Even after the passage of the Orphan Drug Act, they realized there was much more to be done. And so NORD was founded. Today, we are not only the first, but the only organization that's working at the intersection of care, research, policy, and community for all rare diseases. We're the umbrella organization for 7,000 plus rare diseases. Our mission is to improve the health and well-being of people with rare diseases by driving advances in care, research, and policy. So a little bit about patient services and my team. I have the pleasure and privilege of leading a team of 25. 45% of my team have been with me for 5 years or more. All we do is patient assistance, information and resource services, and clinical trial support. So we really are a very frontline, forward-facing team. When you call NORD, you're going to get one of my team members. My team is dedicated as a patient services team. There are individuals whose primary responsibility is our patient assistance programs, others who focus on information and resource services, and still others that focus on clinical trial support. My team staffs our communication center Monday through Thursday from 8:30 a.m. to 7:00 p.m. Eastern, and on Friday from 8:30 a.m. to 6:00 p.m. Eastern Time. A little bit about NORD and the support that we provide to patients. We really, as part of the rare disease community, take a 360-degree view of what do patients need. And so what does that journey look like, from getting diagnosed to having a diagnosis, to living with a diagnosis, to loving someone or caring for someone who has a diagnosis? And so we've really tried to provide comprehensive support, which includes clinical trial support, expanded access, premium and copay assistance programs, medical assistance programs, which for us amounts to out-of-pocket expenses that are not covered by insurance. And we'll talk a little bit more about that in a minute. Medication assistance, travel and lodging assistance for rare disease consults and treatments. We have a rare caregiver respite program and a rare disease educational support program. So we've tried to not only recognize, but understand and speak to that we're more than our diagnoses, and our needs exist beyond access to medication and access to care. So looking not only at medical needs, but some of those quality of life needs as well. When we look specifically at the NORD Fabry Disease Patient Assistance Program, there really are two arms to the program. If you call NORD and you say, I have a diagnosis of Fabry and I need assistance, we're going to talk about those things that are available. And so we can best identify what your specific needs are and how we can best assist. But those two arms of the program, if you will, are what's called premium and copay assistance. That's your traditional patient assistance programs. It helps with health insurance premiums and deductibles, copay costs, coinsurance expenses for things like medical visits and consults, prescription costs, lab tests, radiology services, and supportive therapies, things like physical and occupational therapy, speech therapy, nutritional services. The other side of the program is what we call medical assist. And so what I see utilized the most by the Fabry community are assistance with travel expenses for Fabry-related appointments and treatments, out-of-pocket medical expenses for supportive therapies that are not covered by insurance, and Fabry-related care expenses, again, not covered by insurance. So together, they make our Fabry Disease Patient Assistance Program. It's not important for you to know whether it's coming out of one arm or the other. That's our job. We'll help with that. But it really is so that we can provide the greatest breadth of assistance possible. Eligibility for NORD assistance programs. Well, for the Fabry Disease Patient Assistance Program, you have to have a confirmed diagnosis of Fabry disease. You have to be a United States citizen or permanent resident of 6 months or greater, and you have to meet financial eligibility criteria. I had a lovely conversation a couple of weeks ago with Jerry and Casey, and we were talking about what is that financial eligibility. NORD uses at a high level at or below 400% of the federal poverty level. But we know that's just a number. And so if somebody doesn't meet the eligibility criteria based on that high level electronic income verification, what we'll do is a deeper dive. So the first tier of testing is that electronic income verification and whether or not an individual falls at or below 400% of the federal poverty level. If the applicant does not meet eligibility, we'll take a deeper dive. And we'll have the individual fill out what's called a detailed financial form, which I promise you is not as onerous as it sounds. I really should rename that. We do a detailed financial form. We ask for a most recent tax return and 3 months of bank statements. And with that, we're able to really take a deeper dive and do an adjusted gross income federal poverty level, a financial means test, and an assets versus liability test. And we do that so the individuals have every opportunity to qualify for assistance under our program. If someone still doesn't meet the financial eligibility criteria after those 4 tests, then what we'll do is we'll say, if something changes significantly, or when you file your next tax return, you're welcome to reapply and we'll take another look. In terms of the application process, individuals can apply online through our website. They can apply over the phone. They can email us. They can fax us. We really try to meet our patients where they are. I will say that in 2024, 67% of our re-enrollment applications were done online through our website. But that's not to say that's how you have to apply. If it's easier for you to do so over the phone, reach out to us. Awards are based on meeting the eligibility criteria, funding availability, and our awards are made on a first-come, first-served basis. Awards are made for a calendar year, so if you apply in January, the award will expire on 12/31 of 2024. If you apply in April, the award will expire on 12/31, 2024. If you apply in June, it will expire on 12/31, 2024. If you need assistance in the following year and we have funding availability, we encourage you to reapply. And what we will do is when it gets close to that re-enrollment period, we'll send out a link to enable you to reapply if that's how you choose to reapply, or upon receipt of that, if you want to apply over the phone, again, you have that option. I want to tell you a little bit more about NORD. Some of you may not be familiar with all of our services. So in addition to patient assistance and clinical trial support, NORD has registry programs, research programs, educational initiatives programs. My team also staffs our information and resource services. Sometimes what individuals need most is guidance, direction, resources, really a starting point for what do I do now? My insurance has denied coverage, or I can't afford this, or I need to access that. How can I do that? Sometimes we get calls for unusual needs. One of the more unusual, there was a conversation about beagles at the start of this program. Somebody was looking for financial assistance for pet food for their dog. And so we kind of went down the rabbit hole to try to identify potential resources to help with the expense for dog food. So my team is there to help find resources, to provide information, and to really help the rare disease community to navigate those things that are most important to them at the time. A little bit more about NORD. We have 2 big events a year. In the fall, we have our Rare Disease and Orphan Drug Breakthrough Summit. That's down in Washington, D.C. And that really brings together all of the stakeholders from the rare disease space. So we have folks from the FDA, from NIH, we have legislators, we have researchers, we have patients, we have patient advocacy groups. All together in the same forum. We tend to bring in about 900 individuals to these programs, and our programming is designed to appeal to the intersection of all of these spaces, to policymakers and individuals who may be interested in patient-focused drug development and research and development, interest in registries and other educational initiatives. Coming up in June is our Living Rare, Living Stronger Patient and Family Forum. This program we travel around the country with this program. This year it's out in Los Angeles. So for those of you who may be interested who are out in that area, additional information about the LRLS program can be found on NORD's website. Our website is rarediseases.org. And when you hop on the website, information will come right up about LRLS. And so that's an opportunity for patients, family members, loved one, caregivers to be together. And the program is specifically designed for living with a rare diagnosis. So we'll talk about what it is and how to navigate when you've first been diagnosed, how to be a family member or a significant other, a sibling of someone with a rare diagnosis, and what are some of those challenges and how do you navigate that? Reproductive challenges and some of the decision making that goes into that, mental health support, psychosocial support. And so the program then and there is geared specifically towards patients and families. So I've thrown a lot of information at you about NORD, about our patient assistance programs, about some of the other services that NORD provides. But I imagine that you folks have some questions specific to what you are encountering and what you deal with every day. So I'm happy to answer any questions that you all may have, and we can go from there.
So you can either write a question in the chat box, or you can raise your hand or unmute and ask your question live. Do we have any questions? Well, that was all
Nothing in
pretty
the
straight.
chat yet.
That was all pretty straightforward, wasn't it? Wasn't it, Joe? So
I think
one,
you have a really expert audience here. I have the honor of going last from some of your other presentations, and so they may be very, very well versed. Or I'm just excellent at presenting and answering all the questions.
well, both probably. So I do have a so when we listened to the NORD's program, we realized that NORD has some flexibility that the other programs don't seem to have. So in terms of some of the things that you may not get from the other programs. So if you have something that you're struggling to, a financial need you're struggling to meet, you should contact NORD and discuss that with them, even though it is not apparent from what you just heard or what you read that you may be able to get assistance. And we also noticed, as Jill mentioned, if in the criteria to begin with, in 400% of the poverty level, that they have some flexibility with that in depending on circumstances. So I think this is a NORD's financial assistance program is fairly new compared to some of the others, but I think it has some advantages to some things that some of the others may not cover. So please, let's make good use of that program so they will know our needs and prepare for them for next year and the year after. So any more questions now that I've given you my 2 cents?
Now the first question is about the travel program. Thinking about an individual who is traveling to New York City and there are tolls and there's parking, and is the NORD able to offer that type of financial assistance?
Yes, we are. So that's under at that medical assistance arm. Remember I said you think about patient assistance and you tend to think about premium assistance and co-pays and co-insurance. We deliberately designed our program understanding that a big need, and I do see that with the Fabry community, is that expense for travel, whether that travel is mileage reimbursement, tolls, parking, absolutely. And so that would be covered in that under that program. What we do is we will ask for a verification of appointment letter. Once we receive the verification of appointment letter that you've gone to the appointment, we use Google Maps for mileage and we reimburse at the current IRS mileage rate. And then in terms of tolls, you send us a snapshot of your Easy Pass or the bill that you got in the mail when they took a picture of your license plate, and we can reimburse based on that as well.
Oh, based on that, what about speeding tickets?
We don't pay speeding tickets.
In a picture of that?
No, that one we don't. But actually, so you bring up a really interesting point, Jerry, and it may not be an issue for your members, but sometimes we get asked about what if there are tax bills and things that are in arrears. And patient assistance programs are very regulated. We're regulated by Health and Human Services Office of the Inspector General, and we actually can't pay tax bills, and we actually can't pay tickets and legal bills.
Okay, good. Yeah, I don't think that's a symptom of Fabry heavy
No.
foot.
Okay.
Casey doesn't look
question-
convinced.
The next question, do you supply support for children diagnosed with Fabry disease but not in treatment yet? For example, medical copays.
Great question. So if the individual has a confirmed diagnosis, it doesn't matter whether someone is receiving medication. If they need copay assistance for doctor visits, for laboratory tests, for supportive therapies, we can assist with that. It's not just prescription drugs. And again, I think that really speaks to the fact that the program was designed understanding the nuanced needs of the rare community, and that not everyone is receiving medication or receiving a treatment. And so looking at what are those actual needs and how can we best provide support.
Next question. If an individual is on a Fabry study and isn't receiving an FDA approved therapy per se, is there still a way to get in to apply for a premium assistance?
The short answer is yes. We can't cover those things that are being covered by the study, but you're not getting assistance with your premiums through the study. So yes, you would be eligible if you meet the eligibility criteria for the program for us to assist with the premiums. And again, this is one of the reasons we develop the relationships that we do with our patients, so we can talk about what your actual needs are. Not everyone is going to need premium assistance. Not everyone needs copay assistance. Some individuals just need premium assistance, or solely need assistance with travel and lodging support. So it's why we have that really deep connection with our patients and take the time to have those conversations and say, what do you need? Here are some of the things that we can support you with and help you with. But is there something else that you're struggling with? Let's talk about it. If it's not covered, let's say within the program, suppose you're looking for support with your electric bill. While that's not supported within the program, we can help to find resources that may be of assistance to you.
Okay, I have a frequently asked question for you as well. You are aware that many individuals with Medicare, for example, would prefer to receive their infusions at home. Is that the type of support that NORD can offer?
Another great question. Thank you. You guys are good. So let's say your insurance company says, we're going to pay for the medication, but we're not going to pay for the infusion. So now the insurance company has basically denied coverage for that. That would be covered under the medical assistance arm of the program. Again, it's why we designed it this way, is we understand those needs, that you may not be able or may not prefer to go to an infusion center. And so, yes, we're able to assist with the cost of the home infusion that way.
I would like to mention also that the National Fabry Disease Foundation has a small financial assistance program, and I like to refer to it as the fall through the cracks program. So if you are declined by the primary financial assistance program and you have a bill that no one seems to be able to meet, we may be able to help you. So contact us at info@fabrydisease.org, and we'll see if we can help you with something that you couldn't get help otherwise. And one of the examples is that, and I don't know if you are late getting your arranging your premium assistance, but you've been accepted, and we've had cases in the past where the patient was responsible for providing the first payment, and the patient in some of the programs couldn't provide the first payment. So we would step in and provide the first payment, which started the cycle. And then as as you get your reimbursement, you pay the following payment. So I don't know if that's a good example still today, but if other things happen that fall through the cracks and you're denied by the other programs, we may be able to help you. Thank you.
great resource.
Thank you.
Next question. In terms of the premium assistance, is that for Medicare monthly charges or just PPO?
It is depending on your need. So we can assist with the Medicare premium, we can assist with supplemental, we can assist with Medicare Part D for those who are Medicare insured, for individuals who are commercially insured, we can assist with your premium. It's only assisting with the medical premium. If you're also on a vision or a dental program, we don't pay for the vision or the dental portion of the premium. The premium is only medical premiums for the individual who's diagnosed.
Oh, and we have a question that's a little bit of a repeat, but I think it bears repeating. Is it possible for those on Medicare to infuse at home? It is my understanding that seniors are required to infuse at a clinic.
If you are able to get a home infusion, so there's a service, there is a home nursing that is able and willing to come to your home and to bill NORD, we can pay for that. Medicare will only pay for the infusion, if I understand your question correctly. Medicare will only pay for you to receive your infusion at an infusion center. So this would be something that you're, bless you, that you are denied coverage for. And so we would cover that under the medical assistance arm of the program. But again, there has to be a home nursing service in your area that is able and available to come to your home. We can't provide that service. If there is a home infusion service that can and will go to your home, then we can cover the cost of that through the program if you meet the eligibility criteria.
Okay. And then there is a question about what is the monetary amount for 400% of the financial threshold for acceptance?
So it depends on your household size and the state in which you reside. And I couldn't possibly remember them all. But it's based on the size of your household, and so how many are filed in your tax return and the state in which you reside. It is different if you live in Alaska versus Arkansas versus New York.
Okay, next question. Let's say I apply and am approved. Can I submit only from the date I was approved on, or is it a year benefit I can apply for tests done in January, for example?
So we are able to do a look back, and we may be able to assist with things, with expenses that occurred in January. Typically, we'll look back up to 3 months. In part, it depends on the funding in the program. If we have the funding, we want you to get the assistance that you need. So we will try our best. So it's what I would say is, if you apply and are approved for assistance, speak to the representative who's assisting you with your application and let her know, I need assistance with bills from January. Are you able to assist me? And we will do our best to try to assist.
Thank you, Jill. And regarding the previous question, I started to speak, but I unmuted myself. So we can help a little bit with the numbers of your income limit so in April, we produced several resources for you. One of them that Casey made for us was a chart with all of the financial assistance programs. And she put a link at the bottom where you can click the link to see see the matrix of what your limit is for your size family. And so if you go on our Facebook page, our last newsletter, our Instagram account, Twitter, any of those places, you'll find that chart with the link in the bottom right-hand corner that you can select it and look at your situation. and you can know what your financial income limit is to qualify.
And it is a great resource. Casey was kind enough to share that with me. But understand, even if you don't meet the financial eligibility based on that, for NORD, it's 400% of the federal poverty level. I know for others it's 500%. Don't walk away. Reach out to us, let us know. As I said, we can take a deeper dive and look at things from additional levels. We would have you fill out the detailed financial form, submit the most recent tax return, 3 months of bank statements, so that we can take that deeper dive and see if in fact you can meet eligibility criteria for assistance.
Well, that's great. Do we have any more questions, Casey?
Okay, so this is a specific question for an individual who was awarded assistance for out-of-pocket expenses related to Fabry, including prescriptions that insurance doesn't cover. Does NORD contact my pharmacy, or do I need to submit these costs to NORD?
Another good question. So upon approval, if you tell us who the pharmacy is, we're going to send them a copy of the approval letter. If they
Okay.
are willing to bill NORD directly, we're happy to pay them directly. Our goal is for you not to have to lay out the money and for then us to reimburse. We would rather pay the pharmacy directly if they're willing to bill us. And most of the specialty pharmacies we work very closely with, and they're able to do that. But there are other medications that that an individual may receive that don't come from a specialty pharmacy, and your local pharmacy may not bill NORD directly. And so in those cases, you would need to submit a copy of the bill, proof of payment, and then we can reimburse for that.
Great.
Okay. Oh, and this is a question. I think I would have to get a form from the doctor stating that an individual has Fabry.
When someone applies to NORD, what we do is
Mhm.
we automatically will send a form to the doctor you tell us is treating you, and it's basically called a verification of diagnosis form. Well, technically it's called a CMN, Certificate of Medical Necessity, but basically it's a verification of diagnosis. We'll fax that or email it to your doctor, and they'll return that to us, indicating that you have the diagnosis. Sometimes doctors' offices fill them out with other things, and then we have to contact them and go back to them and say, yes, we understand that they also have diabetes, but this is a program for Fabry. Do they have a diagnosis? Are you able to verify that? So we'll reach out and help you with that.
Okay. And would a letter from the doctor work?
If it's on the doctor's letterhead and signed by the doctor, the same way as if it was on a prescription pad. If it's signed by the physician, if it's on the letterhead and it's a valid verification, yes, we would accept that. But typically we'll send the letter out. We wouldn't hold up the approval for that, but we do need the verification.
And then if you could give a reminder to our audience, how does an individual apply to NORD?
Sure. So you can contact the program directly, or you can go right on our website. The website address is rarediseases.org, RAREDISEAS. I lost track. Rarediseases.org. Sorry, lost track. It's late. I've been at this since 7 this morning. Rarediseases.org.
It happens
And
to me too.
so you're on the website, you click on the box for financial assistance, you scroll down to Fabry disease, and you'll see a box that says apply online. The application will appear right in front of you. You don't have to print anything out. You can do everything right then and there. Phone number is also listed there, so you can call us if that's more convenient for you.
And again, the chart that we just sent out has the contact information at the very top and the phone number, the website and phone number.
And they are also located in the chat for your convenience.
Thank you, Casey. Thank you for rescuing me. I guess I needed one more cup of coffee before the last webinar of the day.
You are perfectly fine. I knew where to find that information.
Thank you.
All right. Any more questions?
Did we answer 21 questions already? Well, I think there was a comment about beagles. That didn't count.
I think that counts. That's very important.
Well, it does count, yes, but not in the same way. Is that all, Casey? Do we have any more questions before we go ahead?
We do not have any more questions, but I think that means it's time for your favorite part of the evening, perhaps,
Yes.
is the random number generator, which more specifically means it's time for our $50 Amazon gift card raffle.
Right. So if you are a primary attendee, which we define as a person with Fabry disease, a family member or caregiver, then put NORD in the chat box, NORD, and we'll give you a minute for all of those submissions to come in, and then we'll do a prize drawing among the contest participants. While you're putting in NORD, we'll give everyone a minute. On my phone, I use a application called random.org. And so I've got that ready. And when I know how many total there are, then I'll say, give me one number from that total. And the random number generator will give us a number for the winter. And we'll ask Brittany who that number belongs to and how you all put your code in. So let me put in 1 out of 12 numbers and say generate. And we got number 11. So number 11, if you can tell me who that is, Brittany.
That I believe would be Kim Barrios.
Kim, congratulations. We will send you a $50 gift card in the mail. And we appreciate your participation. And everyone, thank you to Jill, especially for her presentation, and Casey and Brittany, and all of you for participating in the webinar. And we will hope to see you next time. Anyone else have anything else to say before I say good night? All right. Good night, everyone.
Thank you.